This is the skill removing and applying wet to damp dressings. Complete the 6 essential tasks. Assess for pain and medicate the patient with pain medications 30 minutes before the procedure if needed. Place the patient in a comfortable position that provides easy access to the wound. Perform hand hygiene and apply clean gloves. Loosen the edges of the tape of the old dressing, stabilizing the skin with the other hand, gently raising the edge until taut, pushing the skin off from the tape in the opposite direction. Begin with the top layer. Lift the dressing from the corner toward the center of the wound. If the dressing sticks, moisten it with normal saline before completely removing it. Continue to remove layers until the entire dressing is removed. Assess the type and amount of drainage present on the soiled dressing. Dispose of the soiled dressing and gloves into a biohazard receptacle. Perform hand hygiene. Remove the cover of a tray of a sterile 4x4-inch gauze pad. Moisten the gauze with sterile saline. Apply clean gloves. Gather a gauze pad by pulling the 4 corners up towards the middle. Use the center of the gauze to clean the wound. Gently clean the wound with the saline moistened gauze by lightly wiping a section of the wound from the center toward the wound edge. Assess the wound for location, amount of tissue present, exudate, and odor. Discard the gauze in a biohazard receptacle and repeat in the next section using a new piece of gauze with each wiping pass. Discard gloves and soiled gauze into a biohazard bag. Perform hand hygiene. Now we will apply the wet to damp dressing. Establish a sterile field using a sterile barrier. Open sterile gauze packs and a thick surgical pad onto the sterile field. The amount of gauze used will depend on the size of the wound. Moisten sterile gauze with a sterile normal saline solution or water for irrigation. Don clean gloves. Squeeze out excess moisture from the gauze before applying. Apply a single layer of moist, fine mesh gauze to the wound, being careful to place gauze in all depressions or crevices of the wound. Use sterile forceps or a cotton applicator to ensure that deep depressions or sinus tracts are filled with gauze. Apply a secondary moist layer over the first layer. Repeat this process until the wound is completely filled with moistened sterile gauze. Do not pack the gauze tightly into the wound. Do not extend the moist dressing onto the surrounding skin. Cover the moistened gauze with a thick surgical pad. Secure the dressing with tape or Montgomery straps. Dispose of gloves and sterile field materials into the biohazard waste receptacle. Perform hand hygiene and note the date and time of the dressing. Assist the patient to a comfortable position. Complete the ending 4 tasks.